Hello, welcome back to my channel. My name is Dr. Pepple. I'm a doctor here in the UK and I do videos for international students and international medical graduates who are transitioning to study or to practice in the UK. This is a follow-up to how to pass PLAb 2 exams in 4 weeks. In 4 weeks, guys, it is possible, it is doable. We have done it. I have done it. I prepared and sat for the PLAb 2 exams and I passed it in 4 weeks. And the things I did in those 4 weeks are the things I'm going to be talking to you about today to help you in your preparation for the PLAb exams. In the earlier video, I've talked about the format of the exams, what you should be doing and how you should approach the exams. But going forward, I'm just going to be giving you golden rules on what to do and what to avoid, the common errors that people encounter in PLAb 2 exams. Let's dive straight into it. So just to recap, I've talked about PLAb 2 exams, and PLAb 2 is exams, the second exams you do to get a General Medical Council of the UK license to practice as a doctor, fully qualified doctor in the UK. And that is the beginning of your UK journey where you can work as a non-trainee doctor or you can actually go into residency training. And for you to pass these exams, if you want to go back to the videos I've done before, it's possible to prepare for these exams in 4 weeks, in 6 weeks, 8 weeks, or even 12 weeks. All you need to do is to identify a course to attend, a preparatory course. You need to develop a study routine. You need to join a study group or accountability group where you practice daily on the scenarios for the exams. You also need to have your own productivity space, a space that works best for you, your home, your phone, where you can record yourself and listen to what you've done, or even a mirror where you can speak to yourself and see your reaction and a reflection of what you're doing and actually criticize yourself, and also get other people to listen to what you've done and to criticize you. And you need to be ready to make mistakes and to learn, and just to be optimistic and keep practicing. And if you do all of that, hopefully you're going to pass the exams. Also, there are golden rules and things you need to do to avoid common errors in the PLAb exams. Number one is active listening. If you have a station where you need to do a consultation or you are clerking station, give the patients golden minutes, which is the first minute of your interaction with the patient where you let them talk about all their symptoms. And how do you get to utilize the golden minute effectively? That's when you ask open-ended questions and not closed questions. So when you see a patient, hello, I'm Dr. This, I'm a junior doctor preparing for these exams. How can I help you today? What has brought you to the hospital today? And the patient will go through all that bothers them. In that one golden minute, you don't need to interrupt the patient. Practice less of interruption. Listen. Let your body language show that you are listening actively with the patient. Where you need to empathize, you do that and just allow them talk. In doing so, you can get all the patient's ideas, their concerns, and their expectations in active listening. And also, active listening adds on to your interpersonal skills. Remember, interpersonal skills is one of the domains of the exams. The exams has got 3 domains: data gathering, which is about history taking; interpersonal skills, which is about how you develop rapport and shared management with the patient; and clinical management. One error candidates make during this exam is that they concentrate on the examiner and forget about the patients. Do not do that. What you need to do is to concentrate on your patient, concentrate on the task at hand. Whilst you're doing that, you do not ignore the presence of the examiner. You need to show the examiner that you are actually engaging with the patient, or you are actually engaging with the task. That is one of the big mistakes people make in these exams. Try not to be formulaic. Formulaic means you want to say medical jargons, you want to do everything the way you've been taught in your course. Remember, everything that happens in the PLAb 2 exam is similar to what you have already done as a doctor practicing in your normal consultation room. It is nothing different. The only difference is that this is a coordinated exams. So do not come with the mindset of doing everything according to textbook standard. No, this is a real life scenario, but in a mock consultation pattern. So you just need to be yourself. You need to just talk the way you normally talk. You need to display your charisma the way you are as a person and let your personality show. You don't need to be fake. You don't need to be so formulaic, but you need to be organized and go through everything you need to do in an orderly fashion, if that makes sense. So in a nutshell, you are expected to deal with this patient as a normal junior doctor will do in the clinic or in the hospital. Nothing extra, nothing fancy. Do not forget confidentiality. So if you have a station or a scenario where you have to talk to a patient relative over the phone, or even a patient, you need to ensure confidentiality. You need to ensure that you are sharing this information with the right person. You need to ensure that you have gotten the right identifiers for whoever it is you're talking to. And if it involves you divulging medical information or clinical information about a patient to a third party, ensure that you have obtained consent from the patient or people involved. Otherwise, you will be breaching confidentiality, and that is a grave offense which can cost you failing that station, if that makes sense. Do not forget to ask for a chaperone. In examination stations requiring intimate examination, you need to ask for a chaperone. And whilst you ask for a chaperone as well, you need to ensure you maintain privacy of your patient. So get a chaperone, ask the examiner to be your chaperone. They will oblige you and ensure privacy of your patients. These are areas that candidates who have done so well all along can easily lose your marks, and that will be so painful. And most importantly for me, which is what I found out in candidates who do not do well in these exams, is they lose sight of the actual instructions for each station. So every station is different, every station is peculiar. So when you get to a station, you need to read outside of the station the instructions about the task that you're going to perform. Because if you do not read or understand the task, you might be doing something different inside of the station, and at the end of the day, you've lost all your mark. It might be a station that you're very familiar with, but the instruction might be different from what you've already practiced. That's why you need to approach each station with a clear perspective, with a clear mind. Each station is different. Read the instructions carefully and just follow through. Perhaps you get into the station and you forget the instructions, or you forget exactly what you're asked to do. There's no harm asking the examiner to, can I kindly just read the instructions again? You are allowed to do that. It's only going to take a couple of your minutes or your seconds, but it's better to get it right from the onset so you do not fail that station, because you need a minimum of 11 stations passed for you to successfully pass the whole exam. So where you are asked to examine a patient or a mannequin, just do that. When you're asked to take only history taking, just do that. If you're asked to discuss the management with the examiner, then you do that. Do not discuss management with a patient when the instructions strictly and outrightly has stated that you discuss it with the examiner. That's going to be a fail station, and you don't want to lose such marks unnecessarily. And last point, listen guys, even though we have said over and over this is a real life scenario exams, but with more consultation, medicine is also about showmanship. So what that means is you are not just acting. The patient might be the simulator is acting, the examiner is just there looking at you. You are the real qualified doctor in this scenario. But also, there are certain things you do in your day-to-day practice which will not be obtainable or which will be frowned at in a proper exam scenario. So at that point, you need to put your best foot forward. You need to act it out. You need to show the ideal thing you would do in that situation, ideal thing you would do in an ideal situation. But for this exam, everything you're doing has to be according to current best practice in the UK. So it means even though you don't have to be formulaic, but you need to do everything according to standard. So it means you acting in some way, then do it and make sure you pass the exams. So what I'm trying to say is sometimes you need to smile. Every doctor should smile, no matter how bad things are. So it might not be your nature to smile, but for the sake of these exams, you need to smile. You need to extend your hand to shake a patient when there is need for you to do that, if the conditions permit. And lastly, just be organized. Be an organized doctor. Every patient likes an organized doctor. So that means on the day of the exam, you need to dress smartly, speak very fluently, sound out your words very right, show an air of confidence. Every patient comes to a confident doctor. Remember, most of the things you're going to see in these exams are things you are already familiar with, are things you already know. So just be yourself, just be natural. The patient, the examiners want to see a natural, confident, fluent, conscientious doctor. And that is the way to pass these exams. That is the way, guys, to pass these exams. If you put in your best, do all you need to do, and just take it as you see it, you're definitely going to pass. The last thing I want to say before the end of this video is, during your rest station, you probably will remember there are things that you didn't do well in previous stations. That is not a time to reflect on what didn't go right and what you should have done better. It's called rest station. So you need to rest. There's water there for you to drink, calm yourself down, and just have an open mind and prepare for the next station. At the end of the exams, you can do your post-mortem and think of what you didn't do well, do your reflections and all of that. But all through the exams, during your rest stations, it is time to rest. Clear your mind of all the mistakes you've made and just go ahead and just keep going. It might be that the next set of stations you are gonna go into are even gonna be better than the previous one. So you don't need to be so perturbed and concerned about previous stations that didn't do well. For some candidates, you might be starting off the whole exams from a rest station. That's fine. So take your time and just calm down. Dress smart, eat nicely, sleep well, have good sleep a night before. I always tell people, have 8 hours of sleep a night before the exams, and it's going to help you stay very refreshed, very focused, and very organized. On the morning of the exams, arrive early to your venue. Make sure you familiarize yourself with the area. Just know exactly where everything is, so you're not wasting your time, and just calm down, put in your best and be hopeful. Hopefully everything goes on well, and the next thing is you just be getting your license to practice as a junior doctor in the UK. Hope this helps someone. So yeah, thank you guys for watching to the end, and if you've got any questions, comments, contributions, please do that, and also follow me on my social media handles, which will be displayed on the screen, on Instagram and on Twitter. Ask your questions, and you can send me personal messages like DM. I'm happy to respond to you as well. All right, take care, bye, see you next time.